Today, I'm going to interview a personality in the person of Mrs. Ikobo Ekong. Actually, if you were to ask me to tell you about the person I'm about interviewing, the personality you'll be holding before you, I'll be able to tell you that she's a mother, she's my lecturer, I can never forget that one. She's my lecturer, and she's a very humble woman. She's very modest, and she's a lifesaver. That is by virtue of her profession, and she is a community health practitioner. You're going to learn from her experiences. You're going to glean wisdom from her experiences. I want to remind you that this is the only channel you're going to get authentic information about community health. And please, do well to like and share this video with your loved ones. Keep sharing them until it gets to whoever needs it. Remember to tap on the notification button, that is the red button below. Don't feel you're going to be charged for it. The purpose is for notification purposes only. It's just so that you'll be notified when new videos are uploaded. Please share the video with your loved ones. I know you're itching, your ears are itching to listen to her, to hear her speak. So I will get right into it. Let's go there. I am honored to have you on my channel, madam.
Thank you.
Can you please introduce yourself to our viewers?
All right, thank you very much. I'm Ikobo Emmanuel Ekong, a community health practitioner. I am an alumni of University College Hospital, Ibadan. I work with the Local Government Service Commission, Akwa Ibom State, Nigeria. I'm a primary health care tutor. I am married with children.
I was right. Thank you. So in your capacity, what's your job description?
All right, thank you very much. As a community health practitioner, my job description is being classified into different key areas. The areas are the community-based function. These are functional areas: the community-based function, the clinic-based function, the administrative area, and the training functions. So with this, I would like to go into explaining to you what I do in those different areas that I have talked about.
That would be awesome.
Right. Thank you very much. When talking about my community-based function, I am there to create awareness on health problems that affect the community. I have to create awareness in the community to let the people know the problems that are going on in the community. And as well, I'm able to identify the problems that are there, as well as enlightening the people in the community on reproductive health issues that borders the community members. I also have to prevent and control in case there is any outbreak of disease condition in the community. That is about my community-based function as a community health practitioner. Let me go briefly into my clinic-based function. My clinic-based function involves the treatment of patients, and it is a kind of integrated healthcare services.
Okay, I understand that.
Integrated healthcare services.
But my viewers do not understand. What does it mean?
All right. When talking about integrated healthcare services, it's rendering health services to the people that are coming in all the services that is rendered is in one roof and at the same time, such that the patient that is coming to the clinic will not have to go back and come back again or go to another clinic to get any service he or she needs. A pregnant woman might come into the clinic for antenatal care and come in with a child with fever. So in integrated healthcare services, I'll provide a service to the pregnant woman as well as the child that is coming in with fever at the same time. So that is about the integrated healthcare services. And as well, in the clinic, I carry out treatment of minor ailments with the use of my standing orders, which is a legal backing for me. And with these standing orders, I am licensed to diagnose a patient, to prescribe to a patient, and then treat the patients according to my standing orders with the instruments that I am armed with, medical instruments, to diagnose, prescribe, and then treat a patient. Also, in the clinic, I have to provide quality antenatal health care services for pregnant women and for women that have delivered already, a postnatal health care, and then family planning services. I also provide immunization services to people that are coming into the clinic, as well as giving counseling and screening of patients in the clinic, and a whole lot of work in the clinic. Then I would still like to go into my administrative function at this time, as I act as administrator. And as an administrator, I see to the day-to-day activities in the healthcare facility.
Wow.
I supervise the work of other healthcare workers in the facility and ensure that they are carrying out their health services according to ethics of the profession. That is briefly about the administrative function of a community health practitioner. And finally, my training function. I am in place as a community health practitioner to train students that are coming into the profession to study community health, and also carry out on-the-job training for staff in the clinic.
I have experienced that. So would you say it was easy climbing up to this level?
Right, thank you very much. If you look at our world today, nothing is easy. But that if you are ready and determined to make it, that is when it will be easy for you. I wouldn't say it was easy. It wasn't easy, because just like every other profession, like medicine, like accounting, law, and other professions, it wasn't easy. Why am I saying that it was not easy? It was because as I started as a young school leaver in my journey, as I commenced my journey in community health from the School of Health Technology, getting to the University Teaching Hospital, and then to the University College Hospital at Ibadan, it was not an easy thing. I had to read my books. I had to study hard. I had to sacrifice my leisure to ensure that I get to where I am. It was very, very heavy on me. It wasn't easy. So I will also say that it wasn't easy because financially I have to pay my school fee. I have to buy books, and then I have to travel for those programs that I have to travel and leave my state.
A lot of expenses.
Yes, a lot of expenses. So I have to. It affects me financially. So it was not easy. And then I will want to also say that, coupled with family responsibilities, so and then with children, and most times as a student, I forget my meals to ensure that I study very hard. So it was not easy.
So challenges.
All right, thank you very much. With a lot of challenges that I went through in the course of my study as a community health practitioner, the Bible says with God all things are possible. So it is God that made it possible for me to sail through. And apart from that, it was my determination, because I determined that I am going to continue in this profession till I get to where I wanted to reach. marriage. So determination helped me, and I had self-discipline. Yes, I had self-discipline. I had to discipline myself. And then during the course of my study, I have to sacrifice my leisure. And sacrificing leisure means that all the things that would have been of benefit to me, I have to leave them. That is what helped me. My library was my first book. I didn't have time for trivial issues. So that is what helped me. And then my husband was also very, very supportive.
Wow. He deserves a good
Yes.
Okay, so at this point, I'd like asking you a personal question. What prompted you to choose community health as a profession?
All right, thank you very much. In fact, I really like that question. What prompted me to choose community health as a profession is, before I even get into it, I always have sympathy for people that are sick. I will feel very sorry for them, and I would like to take care of them. I was concerned about my young ones in the family that are sick, and even people in my church members when they are sick. I really want to care for them, and that's migrated into passion. So I had passion to care for the sick. That is what brought me into the profession. And on getting into the school to study profession, I was exposed to the definition of community health, which is that community health is a part of medicine that is concerned with the health of the whole population. So I really enjoyed it. And as I was going on in the profession, I discovered that it is what we call primary health care. And what is this primary health care? I was made to know that it is an essential health care made universally accessible to individuals and families in the community through their full participation and at a cost that the country and the community can afford to maintain at every stage of their development in the spirit of self-reliance.
Wow. So what's your advice to students in schools studying community health and others planning to join the profession?
All right, for students that are studying community health, I would say that you are not in a wrong place. Community health is a noble profession. And in my job description, I was able to tell you what I do in the clinic and all other areas.
Sure, you did.
Yes. So for students that are coming into community health, I will advise you that you be determined. And the Bible says that the fear of the Lord is the beginning of wisdom. For you to be able to excel in this course, you have to reverence God first and be determined to hold on, be focused. Do not be discouraged by every trivial element that may come in. You don't look left and right. Just be focused on that profession and you'll be able to make it. You have to avoid procrastination. You are in school. You have to ensure that you do your assignments, avoid examination malpractices, because in community health, we are handling lives, not files.
Yeah.
So we have to really study hard, read our books, so that you'll be able to carry out those services that in the clinic, to be able to diagnose patients, then prescribe correctly to the patient and treat them. Those ones that are above you, then you refer them to the other healthcare facilities. So then for people that who want to join the profession, community health profession, I advise you to ensure that you have your 5 credits in those science subjects. Mathematics should be there, English language, your chemistry, physics, and biology, or health sciences.
Thank you. So in your opinion, what's the future like for community health and for those coming after you in the profession?
All right, thank you very, very much. The future, for those that are coming into the community health, I want to tell you boldly that the future is bright. There is a very high prospect in community health as they are coming in, especially in Nigeria now that the government is concerned with the health for all. Yes, health for all. So when we talk about health for all, how can you achieve health for all? It's starting from the grassroots. And who are those people that the government will use in order to get to the the grassroots, to reach to the people. Yes, it is going to be the community health practitioners. So I'm telling the public now that the future is bright. There is a very high prospect for community health practitioners.
You can say that again. You can say that again. Thank you so much, madam. It was a privilege having you speak to our viewers. All right, you're soon going to experience what's next. What's next? It's music. A song dedicated to community health worldwide. So please, you relax and enjoy that music. It is written and performed by no other than Moses Eden. Moses Eden, can you please join us on stage? Okay, welcome, Mr. Moses. It's nice having you. We're looking forward to that beautiful music, that rendition you've just dropped. So I want to ask you one question before we begin enjoying the music. What inspired you to write that song and feel you should sing it? Because I consider it to be a talent at the spur of the moment.
Thank you so much. What prompted me to bring out this song titled Concern, Community Health Concern, is as a result that if you listen to people in the community, there are so many people that in most cases, or often they will refer a condition that can be managed in the primary healthcare center to the tertiary institution, sometimes or tertiary hospital, or sometimes secondary hospital, like teaching hospital, and expecting that the cure there will be faster. But that same condition is something that can be managed at the primary healthcare center. But since there is no awareness for people to know the extent of operation of primary healthcare services, so I like to bring it into media, because I really know that people love listening to media, and any good information that we drop on the media can serve as a key point that corrects people's way of thinking. So now bringing this into media to let people know that primary healthcare provides promotive, curative, preventive and rehabilitative healthcare services to the people. Now, that is when you know that most of the cases that the people take to tertiary hospital, they will then know that it can be handled at the primary healthcare.
That's to instill confidence in the primary healthcare.
Yes, that's it. And then, as I heard my lecturer say, that she's operating an integrated healthcare services.
Primary healthcare,
those units are there. You find a place for dialysis, you find a place for OPD, and there is a place for ARV, and all those cases can be well handled according to our standing order.
I'll pause you there, because most of these things, your song carries them.
Yeah.
Before our viewers, please, before we go, I would like to tell you that Moses Edem is a businessman, is a Chu in training. He will explain that to us later. He's a Chu in training, and he is my class rep, able class rep. Papa, we used to call him daddy. And apart from that, he is the NAPMED chairman. Please, Moses, is it in the state or in your local government?
Actually, I am not a NAPMED chairman in the state. Rather, I'm in a class in the local government. NAPMED is where some people may not really understand the meaning of NAPMED.
Please.
NAPMED simply means Nigerian Association of Patent and Proprietary Medicine Leaders. And then at the same time, one of the things that predisposes my effort to be in community health is because I've been into that healthcare section, and then I want to facilitate it. That's why I'm coming to community health, just to make sure I add more value to the lives of the people. Reason more is because I'm passionate about the health of the people.
Thank you so much. That's when we are about listening to the song. Let's go there.
When we all arise, truth go dey panasonic. When we all arise, they can no go dey. When we all arise, your boy don't come no go dey oh. When we all arise, we go push wahala come out. Aha. Now go, please your homie. Thank you, community
Community health provision
provides
promotive, preventive,
curative and rehabilitative healthcare services to the people.
I do this provision because I am pathetic about the health of the people. Your health is my concern.
Community health. Now go. Aha. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. Aha. Now go. We know the best for you. For health education, we know the plan with that at all. Your health is sure when your case is handled by professional. Because we manage and keep your case in appropriate condition. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. Aha, aha, aha. Now go. We care for both the young and old, also neonatal. For you to be in health today, that is my target. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. Care for the patient. That is my concern. Care for elderly. That is my concern. Immunization services. That is my concern. Health rehabilitation. That is my concern. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. We fight am back to back. Mobility condition. We go put an end to that. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. Make you follow what you know. I dey follow what I sabi. Community health professional. That is my concern. Aha, 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 aha. Thank you so much. Thank you so much. Thank you. 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 Now go. When you reach up to the tell someone follow what you know. I don't follow what I sabi. Community.
Celebrate Moses Edem.